Welcome to the Limitless Legal Nurse Consulting Podcast. I'm your host, Anna Gray. The best thing about being a nurse and entrepreneur over the last 25 years are the relationships I've developed and the people I've met. As a legal nurse consultant, I wanted you to hear from those amazing people in the legal and healthcare communities. I wanted you to hear who they are and to celebrate them with me. Get ready to be inspired, informed, and empowered. Let's dive into the Limitless Legal Nurse Consulting Podcast. Hey everyone, welcome to the Limitless Legal Nurse Consulting Podcast. I'm really excited today to have my guest who, on this podcast, I've only had a few physicians here, so I always love having our physicians speak on this podcast. So Dr. Amy Fogelman, thank you so much for being here. I appreciate you being here. You were referred to me by Dr. Stephen Cohen, who I had on this podcast, and we had such a great conversation. So I'm really looking forward to digging in and finding out more about who you are and what you've got going on. So thank you for being here, Doc.
Thank you. It is my pleasure. Please call me Amy.
Okay. You know what? I come from the old school. I've been a nurse for 25 years, and I have a hard time calling doctors by their first name. I really do. I work in the OR, and even, these nurses who are like in their 30s, they're calling physicians their first name, and I go, oh my gosh, I physically can't do it. It's not good, but I'll do my best. I'm accepting it now, so I appreciate that.
Yeah.
All right. So let's just dig in. I always like to get kind of, where you're coming from. You're coming from the East Coast. Where exactly are you?
So I'm outside of Boston. I spent most of my life within like a 200-mile radius. Other than I was born in Arizona on the Navajo reservation. That's like the most interesting thing about it. Okay. But then I grew up outside of Boston, went to Wesleyan University undergrad, where I met my husband. I trained in Boston, went to medical school in Boston, did my residency in internal medicine in Boston, and I've been here ever since.
Yeah. You're not the only one I've talked to. I had a nurse on here as well from Boston who has spent her whole life in Boston. And, it's interesting because I talk to mostly nurses, and the majority of nurses have bounced around all over the country. Yeah. I have not bounced around all over the country either. So there's something to say about that. And I think actually I had another physician from Boston, and I'm trying to think if he had bounced around. I think he had bounced around a little bit, but I love Boston. It's like one of my favorite cities.
Oh, thank you. That's nice. Yeah,
I really love it there.
Yeah, we like it. We like it. We're here because of family,
Yeah. Makes complete sense. Yeah. Okay, so did you always want to go into medicine? Tell me a little bit more about your backstory.
That's an interesting question. Yeah. My dad was a doctor, and I remember playing on the soccer field, and when somebody would go down with an injury, my dad would, run onto the field and go examine the person. It was just like this feeling of pride, I think, and him having that skill, and I wanted to emulate that. Yeah. So yeah.
So you already knew that's what.
Yeah, I mean, I wasn't entirely sure. In college, I kept, wasn't entirely sure. I didn't say, I'm pre-med from the beginning. Okay. I didn't say that. Right. Although I did take all of my pre-med classes and had everything,
just in case.
Totally. And I ended up taking a year off before medical school and did, basically worked out at a gym while working in a lab.
Right.
And applying to medical school. That was what I did.
Yeah. So was your dad, what specialty was your dad?
So my dad was a pediatrician, and he did primary care pediatrics, and he was also a pediatric oncologist specializing specifically in osteosarcoma. So it was sort of actually a really proud moment of my life was when I did my residency at Beth Israel Deaconess in Boston. And we had a smaller cancer center than the cancer center across the street, which is Dana-Farber, which, probably everyone has heard about. And that's where my dad was working. And we had a patient who was very young, who was admitted with our osteosarcoma. And I was a resident on the floor, but the attending was calling my dad, asking how do I do the chemotherapy on the patient.
That's and it was full circle moment. That's awesome. I love that. So did he encourage you to go to medical school? Was he like, yes?
He was a little hesitant. I mean, he I think saw that things were changing. He said to me, get an MBA. And I was like, no, thank you. That doesn't interest me. I think there were a couple of things but he was very proud of me. He knew that this was something that I would be good at. And he was very excited when
it was your calling. It was supposed to be. Yeah. Okay. So you did all of your school. So you took the gap year, which my daughter is doing right now. She's going to go to nursing school, but she finished her bachelor's. She finished her bachelor's very quickly, like a week before her 20th birthday. It was crazy.
Wow.
Yeah, 2.5 years.
Well, then she deserves to take a break.
Right.
Is she doing something fun or?
She's a scribe. She's a medical scribe in Arizona.
Oh, that's great.
She stayed out there. Her boyfriend is still going to school. Yeah. That's why, really.
Yeah.
And she was like, I just want to get experience, Mom. So she got a job as a medical scribe for a big ortho practice. No, it's a really great experience. So now we've been able, in the last year, to really, she understands how medicine works, and the flow of it, and she knows what an H&P is, and all of those things. And she's
interested in it, so she's still going in it for real.
Exactly.
Yeah. I mean, I had when I got into medical school, I quit my job at the lab, and I was a temp because I moved in with my now husband in Connecticut, where he was working as a reporter. And my favorite temp job was at a VNA, and because they would do their recordings of their home visits. And I love doing the typing, the transcription for those home visits. I found it fascinating. And they were like, everybody hates doing these. And I was like, oh no, give them to me, because I just loved hearing about the clinical stuff that was going on. That was, so fascinating.
she loves it. She calls me all the time, about it. So, and she wanted to be a vet in high school. And thankfully they had these college readiness class. She went to a very advanced high school where she finished high school with an associate degree. It's called a middle college high school.
Wow.
So in this district, they had these college readiness classes. So you could take veterinary science 1. And so she took 3 semesters of vet science. And she was like, yeah, I don't want to go into this, which is great, because she was, it was before she graduated high school.
That's
wonderful.
But
what she loved about it was anesthesia. So originally it was like, well, go to medical school, and I work in the OR, and I was like, well, you're young. And if you go to nursing school, you could go and be a CRNA. And that way, if you finish as a nurse, and since you're young and you change your mind, because sometimes we change our minds, you're not too far in, or you can, choose whichever specialty you go. And that really, she stuck with that through high school and through her 2.5 years. She finished with a biology degree, but she was so far into it, she couldn't really jump into nursing school right away. So she's like, you know what, just finish your bachelor's degree and then we'll just move forward from there.
Yeah.
So she'll come home next year and go to nursing school. I can't wait. I'm like, I can't wait. You're going to move back into me, and I'm going to quiz you and all of the things. So it'll be really exciting. But so she's in this gap year, and she was like, I just need a break. I've been working so hard. I'm like, you're 19 years old. Really need a break. And so now, about 3 months ago, she was like, yeah, I'm ready to go back. So I guess there is a thing, about the gap year. So it's okay.
It is.
And you made it through medical school and all of your schooling, even with the gap year. So
totally.
I love it. I love hearing that. I'll tell her that. She'll Okay, so tell me a little bit about your schooling and how that, that journey was. Did you kind of know what you wanted to go into, or was it just, tell me a little bit more about that.
Yeah, so medical school, I really didn't know. I went in with a very open mind, just excited to try everything and see what I liked. And at my school, they very early on, they had, we were by the bedside, and I worked at, the way that I chose my schooling is that I did my patient doctor courses where we learn like how to do examinations and listen to the heart and all of that. So you do that during your 4 years, even though really during the first 2 years was mostly being in the classroom, but there was some hands-on. So I did all of my patient doctor with a neighborhood health center called East Boston Neighborhood Health Center, which was such a great opportunity because I was involved with this like wonderful patient population, this wonderful health center with great physicians who just loved taking care of their patients. And I realized, I really did like clinic. And that became even more clear when I took my first clinical rotation as a third-year medical student in surgery. And I hated the OR. I hated it. I would hide in the cafeteria, in the library, anywhere, so that I didn't have to go into the OR.
Oh, that's so
but then,
funny.
like when it was clinic days, I was excited. Like, let's look at your, foot. Let's look at your wound. And all the surgeons would be moaning and groaning. Oh no, it's clinic day. I don't want to go to clinic. And I was excited about that day. So that was, very eye-opening to me about what it was good for me and what I wanted to do.
It's true. And I, even now talking to surgeons, they do not like their clinic days. They like to operate. And that's why they went into that's why they became a surgeon. So it's interesting to see the other side of it and how much, it's just, you're just driven by whatever you're driven by. So
And thank goodness everybody's different, because otherwise we wouldn't have any surgeons. And it's just so that's what's great. And I just really I really enjoyed medicine. I really enjoyed psychiatry. I really enjoyed pediatrics, although I didn't love dealing with the parents. And I just really, there was this medical, when I was a medical student, there was a intern who was so cool. Like I wanted to be her in the medical residency. She had actually been a physician in Ireland, and then came over and was doing her internship. And I just completely wanted to emulate her. The thing I really liked about medicine was the puzzle piece of it and the intellectual piece of it. Like she would walk into a room and she would know oh, I know what the diagnosis is. Did you notice this about the patient? Did you notice how they were breathing? Did you notice their edema? Did you notice, how they were sitting? Did you notice the color of their skin? And just, it was like, wow, it's a magic trick. And I loved it. And that was how I chose to go into medicine. Probably would not recommend to your listeners to choose your field based on a first year, person out of their schooling, because that's not what your life is going to be like. Your life, you want to talk to somebody who's been doing this for 20, 30 years. But it ended up working out fine for me. And so, yeah.
So then you followed that path and ended up, where did you end up?
So I was in Boston at Beth Israel Deaconess Medical Center, which was great. Yeah. And that was another thing. Like, I really just, it's like a bunch of nerds, internal medicine. But it was similar sense of humor. And I just liked it. I like trying to figure out what is going on with the patient, trying to get to the underlying issue. I just really, really like that. Yeah. I like when a patient comes in to see me and I'm like, I can figure out what is wrong with them.
Yeah, it's like a fresh piece of paper. It's like a clean slate. Okay, now let's figure out the puzzle. I love that.
Yeah. And I will say, like, I really also enjoyed my connection with my patients. And so starting in residency, I had my primary care clinic. I remember we learned very early on, you have to ask about smoking. And the most important thing that you're going to say to them, that's going to save their life, like we learned, is to say that they need to quit smoking. And so I remember one of my first patients, and I'm sitting there with her and her wife. And I'm like, so are you smoking? And she says, I am. And I said, this is going to be the most important thing that's going to save your life. And, I'm just like, regurgitating what I learned.
The script. Yeah.
And she and her wife just started cracking up. And I'm like, why? And then I go to my next question, are you drinking? And she's like, yeah, a little bit. And I was like, are you doing drugs? And she's like, yeah, I'm doing crack cocaine. And that was why her and her wife were cracking up.
Right.
Because they knew that the crack cocaine was probably worse for her than the smoking.
Right.
And I learned a good lesson from that. Yeah. But they she stuck with me despite my gaffes.
Right. I think it's all a learning process too.
like you don't just say these things. You have to.
Right. It's actually,
take it all.
That's a great story. Okay. So that's really interesting. You're my second internist. And I've never met, this is the only place that I've ever really met internists.
You never did like med surge ever?
I did. It was so long ago. And it was such a short stint, and I was such a kid then. So I remember very little of med surge. I did not enjoy it because I was already working in the operating room.
Right. And that was where it was calling
it was my home. I was a surgical tech before I was a nurse.
Right.
And so whenever I was up on the floor, I felt like a fish out of water. I just was like, I don't know what I'm doing. I steer clear. Let's just finish this thing. So but outside of, like in this legal nurse world, I've, dealt with a lot of med surge. And actually I went into clinical IT for about 5 years. So I was the only RN in the IT department at a very large hospital. And so
you probably dealt with a lot of interns.
I dealt with a lot of,
they wanted things the way they wanted things.
Right. Well, this is right when CPOE, computer order entry, came into play. And so we had this like big outflux of physicians that were like, I'm not putting my orders in to a computer. They all retired. And then this new group where we had to teach them how to put orders in the computer.
Yeah, that was when I was in residency, was around that time.
Yeah. So I spent a lot of time educating interns and whoever, you know, and whichever department it was, educating them on how to input orders into a computer. Seems like a lifetime ago. It really kind of was a lifetime ago.
Yeah, it was. But it was a different world.
I got a lot of experience on workflow and things like that when I was in IT, which is quite funny. Kind of like how my daughter's working as a scribe and now she understands the flow of it. There's like, if you're just attached, at some point you'll understand it. When you're sitting in the OR your whole entire life, you're kind of,
you miss it.
You miss it. Exactly. Okay, so let's kind of dive into first the medical legal side of your life, and how did that come about for you? Because this is what I love. Everybody has a different story on how this was presented.
So when I was like a fifth year attending at Mass General, whereas in a primary care practice, one of my senior, colleagues, he would do medical legal work a lot, and he had a particular case that he wasn't, and he didn't have expertise on this. It was actually a trans patient and he had never cared for any trans patients, and I had it at that time. So he referred the case to me. So I reviewed it. It was a medical malpractice defense case, and I loved it. I got the whole pile of records, and it took me a minute to and when I say minute, I mean a long time,
many minutes
to figure out what I was doing, because I remember the first time I was looking at the records, I was like, oh, the patient needs a colonoscopy. And I was like, wait, no, that's not what you're doing. And it had to like recalibrate what I was doing. But once I sort of figured that out, I loved looking at it from this broader perspective. And again, it was using those puzzle, that nerdy overview, kind of looking at it. And I just loved it. So I reviewed the case. I gave my thoughts to the attorney, and, I was really hooked. And from there, I got more cases. Then in 2018, I decided to, I actually mostly left primary care. I burnt out, which we can talk about, but you can imagine why that would happen after 15 years. I was still working in urgent care per diem, which was, much more palatable.
Manageable.
Yeah. But I decided, so my husband actually is an attorney, and he, this I think you might find interesting. When we we graduated graduate school the same year. He graduated law school, I graduated med school. When he took his first job, I said, if you work on medical malpractice cases, I am going to divorce you. So don't do that. And so he was working on a variety of different cases, but I would look, at the medical malpractice attorneys, excuse me, in his office, and just kind of give them dirty looks, because that just seems so horrible to me. And my feelings on this from there, which was a billion years ago, have completely evolved from what I've learned from doing this. So fast forward to where I am now, where I understand the importance of being involved in medical malpractice cases for various reasons. One, just from the perspective actually of somebody who could potentially be sued, you want to have experts who are unbiased and ethical and know what the heck they're doing and are going to, say the truth of what is in those records. You don't want just, the hired guns to being reviewing these cases. You want someone who's a straight shooter who's going to say the truth, number one. And then number two, there are times when medical malpractice occurs. And when that does happen, this is the way for those patients to make themselves whole, or those patients' families. And so when I'm reviewing a case, I try to, and when I'm telling my students, and I'll explain that in a moment, but I tell them to put yourself in the shoes of the defendant, the physician or the nurse, but then put yourself in the shoes of the patient's family members, and then review the case. And that's how you kind of keep yourself honest.
Totally.
So when I burned out, I was trying to figure out what the heck I wanted to do. And it was like a light bulb went off in my head. My husband had been doing personal injury cases and employment cases. And over the dinner table, I've been giving him advice for years about the medical aspects of these cases. And it was like, oh, I could do this and get paid for other people. And so I created a company. It's now called High Rock Expert.
Yeah.
And the thing that I do the most is that I refer attorneys to other expert witnesses, because that is a lot of what I did as a primary care doctor, was referring to specialists and knowing who was out there. And so that is a lot of what I do. And then what I found from doing that is that there's a lot of really, really, really highly qualified medical professionals out there that don't have the foggiest idea how to be an expert witness.
Right.
And so I created my flagship course, the Basics for Becoming a Medical Expert course. And now I have several courses and programs under the High Rock Academy umbrella, where I teach medical professionals how to do this work, how to be successful.
Right.
And that's basically my
story.
That.
I love that. You're an entrepreneur as well. That's the cool part. That's the nerdy part for me that I love. I love entrepreneurship, and this is like 90% entrepreneur stuff on my bookshelf, because I had built businesses before, and so with this business, it's really fun to meet other entrepreneurs out there. And for years I didn't understand that there was a way to merge, owning a business and being in healthcare together. And most people don't know that either. And so it's really fun when it's like the light bulbs hit. Clearly the light bulbs hit for you. It's like, wait a minute, this is exactly how to do it. So how long have you had your company?
Since 2018, so almost.
Yeah.
So
quite a while.
A while now. Yeah.
Yeah. So you have a service for attorneys as well as teaching other healthcare providers.
Correct.
On how to do this. Do you have others? Are you doing the coursework yourself? You're the one that's teaching them, or do you have like a team of?
So the course is hybrid. So it's me, I'm the teacher.
Yeah.
But most of it is recorded, although we do have live sessions. And it's all me, although I am partnering with some additional instructors for some other pieces of the course that I don't teach.
Yeah. And for your courses, do you just focus on physicians, or is there
it's any medical professional. So we have psychologists, we have nurse practitioners, physician assistants, nurses, anybody who wants to learn how to review cases, and to get that like highest hourly rate that you would get as a potential expert witness. And just to remind your listeners, being an expert, technically an expert witness is someone who testifies. But when I say expert witness, I just mean kind of all of that work previously with the potential for testifying.
Sure.
So most of the time, like 95% of the time, you would never end up being deposed or end up in court, but you would still be paid a much higher hourly rate than you would for just doing background work like you would for as a legal nurse consultant. The expert witness rate is higher. So we're talking, for an RN, depending upon your field and your experience as an expert witness, probably like $300 an hour, and more for being deposed or at trial. So it's a lot of money.
Yeah.
Yeah.
It's kind of life-changing money. Yeah, for sure. I have a question regarding, there are a lot of legal nurses that would say, I do not want to do expert work. I only want to do behind the scenes work. And I'm all about giving this comes up in kind of every episode. It's like giving people permission to like do what feels right to them. But I think that when it comes to only wanting to do behind the scenes work is the fear of being put on the spot. What kind of advice would you give a legal nurse that would say, it sounds so interesting, but I'm so afraid that I would do it on.
If you have a phobia of speaking in public, like you have a true phobia, then this isn't for you.
Right.
But if it's just like that you're intimidated and it sounds really scary, think about that first day of nursing school and where you are now. Right. You learned what you know now because you trained for it, you practiced. And so all of these things can be taught.
Right.
The timeline between when you get the case and when you would be deposed or on trial is very long.
Right.
We're talking years. Right. So you're going to have time to be prepared. Right. And if you do it right, if you get the right training, and you get advice from the right people, you're not going to be surprised. And it's always, you think the questions are going to be worse than they are. Right. When I do my deposition training, it's like, what is the thing you're afraid they're going to ask you?
Right.
That's like a really good question because you know what those things are.
Sure.
And then work on the best way to answer those. Right. So your worst nightmare, you know what to say.
You're already prepared for.
You're prepared.
I totally agree with this. This is a funny story because my very first expert case did go to trial, and I had this podcast, and the night before it was okay. So let's talk about the podcast. Is there anything that you've said on the podcast that can be used, against you? And I was like, nope, because this podcast was very intentional because I was going to challenge myself in the expert world. This podcast was very intentional in being just a conversation. We are not speaking about our expertise. We are not talking about opinions. This is just a conversation, getting to know people. And so he said, okay, sounds great. And sure enough, the next day on the stand, so you have a podcast. And I was like, but like you said, I was thankfully he called me because he had a heads up. I think that was going to come up. And I was prepared. I didn't sleep that night because it was, okay, well, what are they going to ask me about this podcast? And it was not as bad as what I was, telling stories in my head. And it was simply, do you have this podcast? Do you talk to other legal nurses? Yes. Yes. Okay, moving on. So it was like, yes, here we are. But it was intimidating at first, but I knew when I started this podcast, I was like, I know what my intention is just in case I run into a thing like that. So I'm very into, thinking 3 steps ahead. What are the possibilities? What could possibly be asked? So that's why for me, I had originally I said, I don't want to do expert work for those reasons, where it was like, I'm afraid of what they're going to ask me. And when I was a young surgical tech, I was in a deposition, and it was the most terrifying thing I've ever done. But it was so long ago, and I've grown as a person and professionally since then. So I said, well, I'm just going to cross my fingers and just hope that I learn along the way. And thankfully, the very first one I did, I went to trial. So it was a lot of learning, in that period of time. But I'm so glad that I went through that. I also have a question for you, because when I got into this field, I'm a first assistant. So I work very closely with surgeons. And the very first thing I heard from some of them were like, oh, you're working for the enemy. Right?
Yeah.
Oh, it's just like you had given kind of the dirty looks.
Yeah.
It was the same thing that I had gotten pushback of, why would you want to do that? Why would you want to work for the enemy and work against us? What would you say? What would you say to a physician that would say that?
Yeah. So I would say the truth is that most of the time, what I'm doing when I'm reviewing a case is saying, like, yes, there's a complication here, but there's no deviation in the standard of care, and stopping the case before it's even filed.
Right.
And if you don't review cases, you don't have the opportunity to do that.
Right. Yeah.
So, and then just like we talked about before, sometimes there is terrible medicine that is being performed. And then we need to hold ourselves accountable. We need to protect the patient. And sometimes, hospital systems will not make changes if they're not required to monetarily. And once they've had to pay a lot of money in a lawsuit, suddenly that complaint that all the nurses have been saying for the past 5 years, that this is a problem, all of a sudden they're willing to fix it because they lost a lawsuit.
Yeah. Yeah. And I completely agree with you on that. It's really, you are being an advocate for your profession. That's how I look at it. I'm being an advocate for my profession. In our weekly meetings now, I work clinically, I still work 2 days a week. And in our clinical meetings, or in our staff meetings, I have the ability to educate, based on doing this. And showing that I am an advocate for, do it right, chart, when you're positioning a patient, make sure that, what you're seeing is documented. You're telling the story. So I actually see it totally different than how he saw it. I saw it as such a benefit to my department and to those that I speak to. For that reason, it's like, then we can either make changes, or or we're supporting the fact that there's no deviation,
Yeah.
So it's nice to hear that. Yeah. I was kind of taken back by it, because
I get that pushback from people, and I don't take it personally. I think that that's just where people are. Probably they've been sued and they're feeling pretty
the fear
bad about it. And, I think, unfortunately, I don't know why in medicine, like 40% of physicians are going to get sued at some time in their career. And this is, I think, one of the things that makes doctors, I was talking to a friend of mine who's a life coach, and we were talking about that. And what doctors hear when they hear that is, well, then I don't want to be that 40%. Somehow I'm different. I'm better. I'm a Superman. But no, that's not what that means. It means that it's just, and you don't have to feel like you're a bad doctor if that happens. Mistakes happen. We're human. And in other professions, one gets sued and doesn't feel this somehow that
right
speaks to them as like a bad, like that they're a bad person.
Right.
So I think that the conversation about that needs to change a little bit.
Yeah.
And unfortunately, you know, in Massachusetts, for example, there is a cap for so when plaintiff attorneys are suing nonprofit organizations, which a lot of hospitals are, they can only sue up to $100,000. And so what the consequence of that is that they end up naming individual parties in the complaints to get around that. And so, I just think that there are, unfortunately, these are oftentimes systemic issues. And, I wish that if it was just, Mass General Hospital being sued and not, Dr. Susan, Smith being sued, then it wouldn't, it wouldn't have that same.
Yeah, no, I agree. I agree.
It would just be better.
Yeah, I agree. That's a very interesting point. I'm glad you shared that as well, because there are different factors involved, and it's not personally, and it's a personal attack to you. It is because of the circumstances that you are on this list,
Right. And you're working as an employee for a system. Like I think it would just, I think that would be better.
So on that same note, this is an interesting conversation. It just came up recently in one of my social media posts, talking about documentation as far as nursing documentation goes. In the old days, it was like the least the better, because the hospital will protect you in, in as long as you didn't put everything down, then they can't say that you did it incorrectly. Right. That was, I remember those days, and I was told that very vividly and very, very specifically by my mentors. And now it still exists. It exists. These conversations come up in, some of the OR forums I'm in, and it still is taught. And yet we look at the records on our side and go, oh my gosh, to their detriment, they did not document. And really just getting that word out. I don't even know if that's the question. I mean, do you see that as well?
I mean, I think, I'm an internist, and internists write like books.
Yeah.
So that's not an issue, I think, in the same way. That's interesting I didn't realize that was why surgeons didn't document. I think that AI is going to kind of fix this issue at some point, because it's just going to be like recorded. And there won't be a question of what happened.
The story, what happened in the story. Yeah. And then that's for us, for nursing too, is, you're describing how the patient was positioned, you're describing what was used without there being a picture, So that's always been a challenge. But I think that people felt like they were protected or that it was the surgeon's responsibility, solely the surgeon's responsibility, and solely the hospital's responsibility. And you were just there to protect the patient, which is true. And the patient comes first. But how do you tell that story? Because that can come back and, bite you.
Like we learn you never die from notopenia. I remember, learning that. So obviously you want to keep the patient alive first.
Right.
Before you write your notes.
Sure.
But but I would just say, I agree with you. I think that it is really important to document what happened as carefully as you can. You can't write things that didn't occur.
Sure.
There is an issue with that I see when I do chart reviews sometimes, where you can tell when things have been copied and pasted and they didn't occur, and so that can hurt you as well. So you do want to be careful to make sure that you're not using the same exam from 3 weeks ago, pre-op, when, something was obviously different post-op, and you're going to get, dinged for that. Because that's just not going to look good on your part.
Yeah. And it's very obvious that that's what occurred. Yeah. Okay. Well, we could talk for days about this. So how can we find you out there in
well, a couple of ways. So you can find my website, High Rock Experts, and there's a whole page for experts if you want to get listed, if you want to learn about how to become an expert, and a lot of additional services like the academy that I was telling you about. So that's there. If you want to follow me on social media, I'm everywhere. Amy Fogelman, Fogelman, MD. I'm on Instagram and also LinkedIn. Are kind of the two places where I am.
Perfect. And that'll all be in the show notes so they can click on and say hello. And I'm guessing that you will have an influx. This always happens. My guests have an influx of messages from legal nurses, which is so much fun. And now I'm starting to get, quite a few attorneys that are tuning in because it's nice to have. I have had attorneys on here and physicians as well. So
I would be happy to reach out to me. Yeah, you can email me at amy@highrockexperts.com. I'm happy to speak with anybody.
Yeah, I love it.
Yeah.
Yes, you're very welcoming. I see that. Well, I appreciate you sitting here chatting with me and sharing your story. Fun. I love hearing your story, and I love connecting with people like you. So thank you so much for being here.
Thank you.
Thank you for joining us in this fun conversation on the Limitless Legal Nurse Consulting Podcast. I hope you found this episode as inspiring and empowering as I always do. And I hope that you share this episode with your friends. If you enjoyed it, I would love it if you could leave us a review or comment, as I would love to share them in the future episodes. Or hop on over into my DMs and send me a quick message. I can be found on Instagram at anna.b.gray, on my website at limitlesslnc.com, and over on LinkedIn at Anna Gray. And I want you to remember, you are limitless. Until next time.